I'm Dr. Amy Stinson, and today we're going to be talking about ventilation tube placement, or myringotomy with ventilation tube placement. This is a surgical procedure that is commonly performed in adults and in children. Most likely, your primary care physician or your ENT has recommended that you need tube placement for one reason or another. The most common reason for this that we see in kids is for chronic serous otitis media, or for chronic ear infections. In a lot of these kids, the infections come and go very frequently, causing a lot of antibiotic use and high temperatures that can't seem to be controlled with antibiotic use. Another condition that we worry about in children is hearing loss. That's why this procedure is so important in this age group. The anatomy of the ear, as you can see right here, shows our ear canal, our eardrum or the tympanic membrane, the three little ear bones that vibrate and send sound to our cochlea, which sends it up the nerve to our brain, and this is how we hear. It's in this space where there's three little ear bones that vibrate that we get ear infections. The whole reason behind this is because of eustachian tube dysfunction. This is a tube that drains this middle ear space into the back of the nose. In kids, this is much more common because this tube is at a horizontal angle, only about 10 degrees. And it's also very, very small. So any sort of virus or allergy is enough to make this tube not function properly. And this is the basis behind chronic ear infections. The whole purpose of placing a ventilation tube is to replicate the function of this natural eustachian tube. The way that we do this is in a surgical suite with children because they can't tolerate laying flat and still for that amount of time. All they require is a little bit of gas anesthesia. They usually don't require an IV or any more medication than that. We're able to use the microscope and look directly at the eardrum. When we do this, we're able to clean out any wax or any debris that's in the ear canal. We then place a very small incision in the eardrum. Through this incision, we can suction any fluid that has remained behind the ear or any infection. So if your child does have continuous ear infections, it's still okay to perform this procedure while they are infected. We then place the ventilation tube through this incision site once all of the fluid has been removed from that middle ear space. The ventilation tube is very small. It's only about the size of the tip of a pen, or a few millimeters across. This is enough to allow ventilation in and out of this space to help this eustachian tube recover and mature. The risks that are associated with this procedure are actually very minor. Once the ventilation tube has been placed, we expect to see drainage from that ventilation tube. That's one thing that we want to see happen. And this drainage can be anything from a clear watery fluid to a thick green or yellowish discharge, or even blood. This shouldn't be alarming if you see these things draining from the ear. Those are all natural signs of ear infections, and they can be treated topically with ear drops versus an oral antibiotic like you needed before you had the ventilation tube placed. There is a small percentage that the ventilation tube will not come out of the eardrum naturally. That's about 1% or less. The other risk that we worry about with this procedure is that once the ventilation tube comes out, there may remain a small hole or a perforation in the eardrum after the tube has completely extruded. Occasionally, we do have to go in and patch this. This is also a minor procedure and usually does not require more than a simple patch job. We expect ventilation tubes to stay in place for around 1 year's time, but anywhere from 4 to 6 months to 2 years is considered average, and we don't need to worry about them while they're in place during this time. As those tubes generally come out, though, we do want parents to be aware of their positioning and their functionality. That's why we like to check on you every few months just to make sure that the tubes are functioning properly. Most kids only need one set of ventilation tubes, and that's enough for them to mature and grow their eustachian tube and allow the ear to start functioning normally. There is a very small percentage that do go on to have chronic ear disease that may require additional sets of tubes and/or an adenoidectomy to help try and relieve this problem. And there's even a smaller set that go on to need tubes, such as a more long-acting or permanent tube that will last for years at a time. But this is the minority versus the majority. This is a minor surgical procedure that only takes about 5 to 10 minutes to perform in the operating room. Normally, small children are given an oral sedative before heading back to the operating room. This does have some sort of an amnestic effect so that they won't remember this procedure at all, even though they will be completely asleep with the gas anesthesia that they will provided. Again, an IV is usually not necessary for this procedure alone. After surgery, children are often confused when they wake up, and this may lead to crying or difficult behavior for the short term. This is usually temporary and goes back to normal within the day. If they go to a preschool or a daycare, they can usually go back to that setting the next day after the procedure. Most of the time, kids don't require any additional pain medication. They are given some pain medication during the procedure, and usually ibuprofen or Tylenol is enough to relieve any other discomforts that you think that they may be having that day. Fever is also normal after receiving an anesthetic agent. If you feel that the fever is affecting your child, you do need to give us a call so that we can evaluate them. Usually water precautions are not something that we worry about. This is a common topic that is discussed among lots of parents that are having ventilation tubes placed in their children. Generally, bath time, shower time is not a time to worry about water getting in the ears, especially in very, very young children. If your child is school age and is able to swim, if they're able to swim to the bottom of the pool, that's usually the time when you would want to start plugging ears when you have a ventilation tube in place, because they're going under the water will allow pressurized water to go into that middle ear space and potentially cause an infection. We also worry about lake water or ocean water, but those are usually the most things that we worry about. Bath time is not something to get crazy about with your earplugs, so don't worry from that standpoint. If your child does have a lot of persistent drainage, that's when we do start to recommend plugging full time around any water exposure. Overall, there are quite a few benefits to this procedure. Hearing loss is immediately gone once the procedure is performed. So if your child had persistent fluid behind their eardrum and we were able to remove it at the time of surgery, they will be immediately hearing differently and better. A lot of times children express this by playing or messing with their ears. It doesn't necessarily mean that their ears are hurting them. They just don't understand how this new sensation is happening for them because they haven't heard things like this before usually. Also, the infection is usually gone at the time of surgery as well. But if you did have fluid, we will place you on ear drops for a few days to make sure there's no residual infection that remains. Again, if any drainage does happen during the time the tubes are replaced, we'll use strictly an ear drop to clear the infection. Usually oral antibiotics are not needed. In conclusion, ventilation tube placement is a very common procedure that we perform in children. If you have any questions regarding this procedure, its risks, its benefits, or its complications, please contact your primary care physician or your ENT.